Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have our board-certified plastic surgeon, Dr. Joseph Mele. And today we're talking about facelifts. Later, we'll be taking your calls, answering any questions you might have about the face. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, certainly you're going to want to consult your own physician as well. Second opinions, advised, required, really. I mean,
well, it's a good idea, because there's an expression, if you ask, 2 or 3 plastic surgeons for an opinion, you'll get 4 or 5. I mean, there's more than one way to do everything, and what's important is you've got someone who's qualified, who's comfortable with the way they're showing you to do it, and then it makes sense to you. And if it doesn't make sense, another opinion is really helpful.
Well, that's really sound advice. Thank you for that.
Sure.
When we're talking about facelifts, there are obviously many ways to go as we age and gravity takes effect. Things start to fall downward.
Yeah. Gravity is a weak force, but persistent.
Persistent, yes.
Yeah.
And you have in your arsenal, in your bag, all kinds of tricks, and certainly there are ways to forestall some of the effects of gravity with injectables and Botox. And talk to me about that, and then we're going to work our way up to
the real thing.
The real thing.
Okay. Well, the nice thing about the injectables is it's an office procedure. It can be done. You can go home at the same time. It takes a few minutes. It may cause some bruising, which sometimes takes a few days of recovery. It may cause a little bit of swelling. Usually goes away in 24 hours, but there's really not a sort of investment in time in recovering from the injectables. And for lines like along the nose, down to the mouth, the marionette lines down below, very helpful, and may even work better than surgery in selected cases.
Okay, but these are minor tune-ups.
Smaller lines, but even moderate to deep lines can be treated with fillers. And there's a lot of times when I'm doing a full facelift to help more with the jowls, loose skin on the neck, when I will take some of that skin that we would normally throw away and bury it here and use it like a filler that's a person's own tissue, so it'll last longer.
All right, now this is getting very complicated.
Already?
Yeah, we just started. But some of the other tricks, you use Botox, and that kind of gives you a little lift.
Botox is helpful for animation lines, so lines that are caused by muscle motion. We can slow down. It's better for around the eyes, the upper part of the face. We can get rid of frowning without making someone look like they're odd, but if you get rid of smiling, that's not so good. So the lower part of the face has to be very, very selective and careful with the use of Botox there.
Okay, so say you've kind of worked your way through all of this and you've reached that point where, wow, you need a little extra help.
Sure. Well, usually the other areas of the face that start to show changes are more the lower face than neck. So we get some loose skin on the neck. Fillers can't really fill up enough to get rid of loose skin. Botox doesn't work very well, though occasionally we use it for single lines. On the lower part of the face, we get jowling or deeper lines in this area. The facelift is able to unload that area, so we actually bring the skin back, take away some of that weight. What's happening is a combination of gravity pulling things down and then loss of volume. So we do lose volume as we age. If you look at a baby's face, it's big and round and full of fat. And as we age, we lose the fat. We lose it in their cheeks, so our face gets narrower. We lose it in the lower part, so we can get a little more hollow. We get a longer face and a narrower face, and that's sort of an aging face. So we were trying to fix that by moving that skin back up where it belongs.
Now, over the last, I don't know, what is it, 10 years, the aesthetics have really changed, because it used to be there wasn't that consideration given to the loss of fat, and so after so many facelifts, it just looked like, skin over bone.
It can be over-tightened, and then, we've lost the definition. What we're still missing in our armamentarium is some sort of filler that we can put in with larger volumes to replace that fat that's lost, and certainly in the cheeks would be the ideal place to put it. There are things in the work. There are hyaluronic acid fillers similar to what we use now, like the Restylane, Perlane's, Juvederms, that in the next probably 2-3 years we'll see that allow us to add more volume in a larger area and probably deeper in the face.
When you don't hear about facelifts so much, and I guess that's the idea, right? You don't want it to show.
My goal after I do a facelift is that the patient's family may know, they may have been told, but friends and such may just ask if they're on vacation, they look rested, they feel better. A lot of times the pictures will look dramatic, but if I can keep someone looking like they're supposed to look, the results aren't so dramatic for the people around them. They just look younger and happier and rested.
Well, we've got to take a break. We've got some interesting photographs that you brought with us, but for more information about Dr. Mele, you can call him at 925-943-6353 or check him out at his blog at sanfranciscoplasticsurgeryblog.com or visit his website, drmele.com. And we'll be talking with Dr. Mele about some of the different types of facelifts. Plus, we'll be taking your calls when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.